Kpandai is a district on its own and is supposed to have a district hospital. So you have the patients come in and then the registration staff. Monday we had almost 60 patients and I have to go through this lot. So we use this, we clean these bottles up and reuse them for the laboratory, taking specimens from the laboratory. And that is why he's cleaning them up. This is our ward, the male ward, where we detain cases. Yeah, this old man had a snake bite on the arm. Apparently, he cannot see very well, and he was farming. He held a snake. Then the snake bit his finger, and the whole arm was swollen. You can still see a bit of the swelling here, and he had. We had to incise to drain the blood. It got infected. So we're dressing the finger now. He's recovering very well, yes. So these are very common things that we have, snake bites. And the drug is very, very expensive and not available in the system, not easily available. And so we would appreciate any form of help in terms of getting snake serum. Yes, we buy it at a very high price. It is not easily available in the system, and so we would appreciate any form of help in terms of either the drug or in form of financial assistance that we can use as a revolving fund to make the drug available all the time, so that anybody getting a bite can then be helped. Right now, an ampoule of a snake serum will cost about 1,200,000 or 1.5, but yeah, that is what it costs now, and it's difficult for very poor people in our area here to afford. Man came with a breast abscess, and it was a very big swollen breast with an abscess, so we cut open and we have treated her. It is now, the wound is now getting clean and she's better. So she's now on daily dressing. So these are some of the conditions that we normally see at this level of our health center. And in the community, we have a lot of breast abscesses, very infected. Some of them don't know even how to handle it. So, yeah, this is much better. So we need more gauze, more dressing materials, which we would appreciate. This wound started as a result of just an abscess in the house, but they didn't know what it was. They didn't think it was going to be a big infection. So they were using local medicines to treat it, and then it became septic. He couldn't move his leg. The leg was very big as this. So they brought him not able to walk, and I had to incise to drain the pus, and then we did a lot of packing into the wound until it filled up to this level. So ignorance has made them, the poor boy, to suffer this way. And so these are some of the problems we encounter in the rural area. This is the only vehicle we have at the center here, which we use as an ambulance to refer patients to the hospital. But for 2.5 years now, this vehicle has been broken down and we are not able to get a replacement. And so we will be very happy if there is any assistance in terms of an ambulance or any. It is the same vehicle we use to purchase medical supplies to this very center. And we need a doctor to come here to help us to upgrade. Immediately we get a doctor, this center will be upgraded into a hospital. And that is what we need right now. Because we have to refer cases from here to the nearest hospital is over 119 kilometers. And the road is quite very, very bad. If you see the road from here to the nearest hospital and having to travel with a pregnant woman who is in labor, that is a big problem. And so getting a doctor here will hasten the development of this center into a hospital, whereby we can get all the necessary facilities like the theater to be able to operate on cases and to get more personnel qualified that will help to run the district. I appreciate short-term workers like doctors and nurses, again midwives, those who have gynecological knowledge in midwifery. It will be very beneficial to us. It's possible that they can come and then we will appreciate their help. And also, if it's possible for us to get a long-term worker, either nurses or doctors, we will appreciate that. That we will have to work it out through the government for their residency and then for getting their licenses for them to be able to practice. It is possible because this is a rural area where it is difficult to get even our own Ghanaian doctors coming. So that will be very much appreciated if there are people who are willing to give themselves as a service unto the Lord. Yes.